today's episode of Health Check, where together we check on our country's health concerns. In today's episode, we look into a rare genetic condition called Prada Willi syndrome. Now, Prada Willi syndrome is a genetic disorder usually passed down by the father. One impact of this syndrome is that the brain signaling to the stomach that it is full doesn't happen, which can often lead to problems like obesity. Now, my trusted colleague, Dr. Nosipo, spent some time with a family dealing with this syndrome. Let's hear the story.
It felt like an eternity because you want to know what's wrong with your child, if there's something wrong with her. And I just thought that maybe she was this sweet little baby that wasn't crying. She was very floppy, very hypertonic. And then on the second day when the pediatrician came in, she tested her and she said, or she saw that she was still floppy. But then when they took her to NICU, I got really scared because I was asking them, but what are you looking for? Is there anything you want to test her for? And they really didn't give me any answers. I think she was in hospital for about 2 weeks. We went to the neurologist and he had her tested for a couple of stuff, but one of them was Prada Willi. My name is Brenda Butler. I'm married to my husband Derek now for 11 years. And we have Auri, that's our youngest daughter, and Dunay, the older one. Auri is 6 now and Dunay just turned 8.
And tell us a bit more now about your pregnancy with Auri. You had your first daughter. How was it with your second pregnancy?
The second pregnancy was more or less the same, and at 35 to 36 weeks, I went to hospital. Everything was fine. And then after she was born, she was very floppy, very hypertonic. And then on the second day when the pediatrician came in, she tested her and she said, or she saw that she was still floppy. She didn't wake. She didn't want to have anything to drink. We struggled with her to breastfeed. Yeah, they took her to the ICU, the NICU, on the morning of the second day.
And then that's when you eventually got the diagnosis after you had left the hospital?
Yes.
So it had been some time not knowing what was going on?
Yes, during those 6 months, it felt like an eternity because you want to know what's wrong with your child, if there's something wrong with her. And some days you wake up and you think, oh, no, man, they're going to find nothing. There's nothing wrong with her. She's such a sweet baby. And she was still struggling to feed. She still had very low muscle tone.
So the diagnosis for you made you feel relieved? You didn't feel anxious or afraid when they told you what it was?
No one actually knows what's going on with her. So yeah, after the diagnosis, we really felt freed. It was hard to accept, but luckily we knew what was going on.
And since then, what has your day-to-day life been with her? Because I'm sure once you got the diagnosis and you knew what you needed to do, you had to set into a routine as a family.
Yes. When she was still that small, we didn't really have we had a routine with Dunay and we just carried on with that routine. We had to start to give Auri the growth hormone injections. So that became part of our nightly routine.
And the food seeking, is it part of one of the manifestations of her diagnosis or one of the symptoms of her diagnosis?
Yes. The main thing for them is that their brains and their tummies, if I can say it in plain English, don't talk to each other. So the tummy will be full, but the brain won't tell, or the tummy won't tell the brain that it's full.
So you've had to set times for her to eat, what she should eat to try and manage that.
Yes. So the routine in the morning is when she wakes up, she wants something to eat. Then she wants pop. Mama, ek wil pop hê, ek wil pop and milk. And then she plays a bit, and then we try to keep her feeding times at the same, it's at school. So then 10 o'clock she has something else to eat, and then 1 o'clock and 3 o'clock, and then the aandkos. Ari praat van 'n aandkos, 3 uur kos en aandkos. So yeah, that routine really helps us, and it helps her as well. Like I say, so that she doesn't get anxious, because she will ask me when we go somewhere, but when are we going to eat? What time is it? Is it op tyd vir 3 uur kos? So the routine really helps with that.
After the break, we hear from little Ellery and speak to our expert about Prada Willi syndrome. Prada Willi syndrome can also lead to issues such as temperature abnormalities, pain insensitivity, hyperphagia, and dysphagia. This syndrome's characteristics include, amongst others, behavioral changes and food-seeking challenges. Now, these are the 2 main issues that will face them for life. Low muscle tone is just part of the syndrome and is caused by a low amount of growth hormone in the system. Children or adults living with this syndrome typically have short stature and small hands and feet.
Ellery, do you want to tell us about yourself? How old are you?
Hallo Tannie. Sê vir die Tannie, hoe oud is jy?
6. What grade are you in?
Graad
What's your favorite subject?
te werk
Wat se werkies hou jy die meeste van?
in kleur.
Coloring. And do you know what's wrong with you, Ellery? Do you know that you have Prada Willi? Do you know anything about that? What is it?
Sê vir die Tannie, jou vlegseltjie lyk anders as ander maandjies se vlegseltjies. En sê vir haar, dis hoekom ons Oranje dag hou. Nee, vir Ellery.
Is that the Prada Willi day?
Yes.
Okay. And what's your favorite thing to eat?
Bananas.
Bananas. Why bananas? Not cake. Not cake. But how do you manage, especially with a little girl with such a big personality,
Yes.
to guide her in the direction that you need her to go with the food? Like to stick to a strict diet, to eat at a certain time. How do you encourage her to do that?
Our whole family knows that she has specific times that she can eat, and when we go to a braai, my friends, I've got a really good support system, I have to say that as well. Maar ek probeer regtig nie om kosse van haar weg te hou nie, soos jy net nou gehoor het, sy sê 'n piesang is haar favourite ding om te eet, maar 'n piesang kry sy baie min, want as die piesangs in die huis is, dan verorber sy hulle, so ek koop piesangs nogal min, maar ek het al van dit hulle klein is met doen, hy was dit dieselfde, gelukkig hou ons van gesonde kos. Sy het nie 'n pyn om broccoli en wortels en pampoen en allerlei gesonde goedjies te eet nie. Solank sy net kan kos kry, sy gelukkig. Net nie vir tomaties gee nie. Sy hou nie van tomaties nie.
1 in 15,000 children are born with Prada Willi syndrome, and that's approximately 20,000 people living with the condition worldwide. I'm interested to know what we and our viewers can learn from our expert about this condition.
What an incredibly spirited young girl we've just met there, Dr. Nosipho. Well, now to help us understand just exactly what Prada Willi syndrome is, we're joined by Dr. Angela Honey, who's a pediatrician doing great research into children with genetic defects. She's currently a senior lecturer at the University of Pretoria's Human Genetics Division of the Department of Biochemistry, Genetics, and Microbiology. Dr. Honey also serves as medical advisor to the South African Prada Willi Association and is also professional delegate of the International Prada Willi Association. Dr. Honey, welcome to Health Check.
Good morning, and thank you very much for the invitation.
Well, talk about the condition that is dear to your heart. Not too many people know what Prada Willi syndrome is. Could you just perhaps just in simple terms explain to us what this condition is?
Prada Willi syndrome was described by 3 doctors, Dr. Prada Willi and Dr. Labart, and they describe children with intellectual disability and then severe eating disorder where they eat without stopping. You know, they have this insatiable appetite And eventually, after many years, they found out what is the cause. And since then, it's been known as Prada Willi syndrome. So it's purely a genetic condition. So nobody did anything wrong and there's no blame. It already happens when the baby is formed in the mother's womb. And it is due to an abnormality of a group genes on chromosome 50. There's a few mechanisms, but the abnormality is on chromosome 50.
All right, we're going to come back to the detail of that, but you know, I'm sure that many people watching this program haven't heard of Prader Willi syndrome. How common is this condition?
It's regarded as about 1 in 15,000 births. I do think that's obviously in countries where it's widely known and there's testing available. So I think in a lot of cases it's underreported. In South Africa, we definitely don't have all our cases and all our patients is not being identified. I think because either people and doctors don't really know about the condition and can diagnose the condition.
Well, talk about knowing about the condition and diagnosing it. You started telling us a little bit about, what people go through, that is those that, suffer. What are the typical clinical features then, just to perhaps help even some of the doctors watching this program?
So the features already is present during the mother's pregnancy. So if you really go back and ask the mother what was the fetal movements, she will definitely indicate that it was reduced. It's obviously in the second pregnancy, when she knows what the baby's movements are, it's easier for her to detect that the movements are reduced. Then at birth, these babies are very hypotonic, floppy, so they don't move a lot, and typically they struggle to feed. So usually needing nasogastric tubes, that's tubes going through the nose into the stomach, and really need help to start to feed. And then eventually you get them off the tube, and then from about a year, 2 years of age, it's like they want to make up for this difficulty in feeding. Then they start to have this excessive appetite. And if you don't control their intake, they can really eat a lot. I think one of my parents said they forgot a cake on a table, and the next morning the whole cake was gone because they don't feel that feeling of fullness and I must stop now. And that, I think, is the essence of the syndrome and what makes it so difficult for parents to cope with this syndrome.
Right. I would imagine people watching this program would want to know, so who's at risk of developing, this condition called Prader Willi syndrome?
It's nobody's fault and nobody did anything wrong. Some articles have actually suggested that it's more common in fathers of advanced paternal age. I think when I look at some of the families, I do see that it happens in some cases that the fathers are a little bit older. But I don't think that's been proven without any doubt. So I would say anyone is at risk.
After the break, our insightful expert, Dr. Hani, gives us her final thoughts about Prader Willi syndrome.
So we've already spoken about how she's a little bit shorter than the other kiddies and the food compulsivity and eating a lot. But are there any other challenges that you've experienced with Prader-Willi syndrome and managing it?
She has some behavioral issues. I can't say that it's more than any other child's tantrums. And for her to get to exercise is really difficult. She doesn't want to do the gross motor skills. She only wants to color in and do the fine motor stuff. So exercising is quite a challenge, but we are joined at a gym now where they also take the kids. So that's really nice when my husband and I go, and then Dunay and Auri go to the kiddies department.
Thank you.
Thank you.
Can you imagine your mind not being able to tell your stomach that we're full? And imagine that as a child. And even though this is quite a difficult condition to manage, Auri and her family, with support, routine, and a good diet, seem to be managing really well with her condition.
So just you mentioned earlier, and I'm just going to take you back to if you have that kind of scenario where you have a couple where the father is perhaps of advanced age, and they want to make sure that they do all the necessary screening, and the pregnant mother is prepared to undergo amniocentesis. Are you saying that at that point it is possible to pick it up?
Yeah, strictly speaking, it is possible to pick it up on an amniocentesis. But my question always is, with the risk of 1 in 15,000 and having fathers of advanced paternal age, which patient will you ask to do it? So if a parent knows about Prader-Willi, they are worried, and they are either way going to do an amniocentesis, for instance, for Down syndrome, I would definitely say let's do the testing for Prader-Willi too. But, I don't think, amniocentesis will pick up every single genetic condition. And that's why we don't usually, even if parents previously had a child with Down syndrome, we don't even routinely, offer them a test for Prader-Willi. We'll come back to the recurrence risk most probably, later.
You started talking about the importance of looking at what they eat and difficulties around, schooling and so on. But what sort of treatment is given to these children from an early age onwards?
The major breakthrough in Prader-Willi syndrome care has been the administration of growth hormone. Children with Prader-Willi syndrome do eventually become short, so they become short adults. But growth hormone also has other facts, advantages. It helps to improve muscle mass. It improves their low muscle tone. So we start usually quite early on with growth hormone treatment. At this moment, some medical aids will pay for it. It is expensive. We struggle to get the children on growth hormone in the state sector, although it's been proven to be of help.
Is it long term? Do they go on growth hormone for life, essentially?
So initially, it was only given till puberty, but there's a lot of centers overseas that motivate that they carry on with growth hormone throughout their life. But that obviously becomes very expensive, because to give a 3-kilogram baby growth hormone is much more cheaper than giving a 30-kilogram person. So I don't think many countries did adopt growth hormone throughout life, but usually up until puberty.
Well, I would imagine, if it's an expensive drug, access would be an issue, both in the public and the private sector for that matter. Is there any other form of supportive therapy other than growth hormone that's given to these children?
There's a lot of emotional and behavioral problems, which in the older people with Prader-Willi really becomes a major obstacle, is that they really, really want to get food which they can't get access to such an extent that they will go into the fridges, they even will go into dustbins to go and look for food, steal food. A lot of things about is stealing then a crime because I want food, I can't get food, so this is food available to me. So there's a lot of debate and a lot of treatment on these behavioral abnormalities that we do see in children and adults with Prader-Willi syndrome. For their developmental delay and eventually intellectual disability, they will definitely need occupational, speech, physiotherapy, biokinetics. So there's a whole group of people that will be involved in their care. But drug-wise, the major research happening now is how can we get this excessive appetite under control? There's a little structure in the brain called the hypothalamus. That structure is involved in growth hormone secretion, and your satiety center is also in that structure called the hypothalamus. So they've used drugs called oxytocin. That's a drug that makes people feel a little bit better. But I must say, I haven't really had the confidence to really say this drug is the miracle drug for Prader-Willi syndrome. So what really needs to happen is a routine. Breakfast is at 6, lunch is at 12, supper is at 6. You don't eat in between. You actually only eat a certain amount of calories. And unfortunately, the calorie intake, because they have a very low metabolic rate, is less than what a normal individual would take. So you can imagine that excessive emotional stress these kids go through. So if you talk to them, a lot of their mind and what they think of is food. You know, they will really at breakfast already think about what they are going to eat at lunch. And they will kind of contemplate and kind of, tell the parents, I want this for lunch. And unfortunately, because you actually have to restrict the calories and they want more, there's a lot of emotional and behavioral problems.
Well, Dr. Angela Honey, thank you so much for your time and all the best in all the future work that you're doing for research in Prader-Willi syndrome. Thank you. I hope you found this episode on Prader-Willi syndrome as interesting as I have. Don't forget to follow and like us on all our social media platforms on Health Check SA, where we host live interactions and you at home can interact with some of our expert doctors online. But until next week, stay healthy, stay vibrant, and check in on your health. I'm Dr. Sello Mutaung, and you're watching Health Check.